Hi, I'm Karen Stark, and I want to thank everyone for taking time to learn about all the worthwhile charities supported by the CFC. The Hugs Project has been doing our job for the past 17 years with a low overhead of 1.4%. Not one of us takes a salary. Deployed troops in places like Djibouti, Afghanistan, Iraq, Romania, and even Syria have written back to tell us things like, "You're on every mission with us. You're the socks on our feet. You're the beef jerky in our pockets. You're the Tylenol we take when we have a headache." If any of you have a loved one who's currently deployed in harm's way, please go to our website at thehugsproject.com to request a care package. There's never a charge to our military or to their families. Well, after years of supporting some of America's finest with care packages and letters, we realized that those coming home with what's called post-traumatic stress were having a hard time getting back into life. They have trouble sleeping, they fight anxiety and depression. Some of them are combative and can't hold a job for longer than a few months. They constantly fight with loved ones, and inevitably they wind up in divorce court. Probably some of you know a family that's been torn apart by the effects of PTSd. They wind up unemployed, divorced, homeless, and way too many become suicidal. The medical term is PTSD, a mental disorder. But is it really only that? We're beginning to wonder. We believe for many of our combat veterans it is a hidden wound. Brain injury caused by head trauma such as rollover accidents and especially blast waves. They come home and think, "Man, I'm lucky. That IED went off across the street and I got to keep my legs." Then they gradually realize life is becoming a struggle. As early as the Revolutionary War, when cannons exploded and blast waves lifted soldiers high into the air, it was called a soldier's heart. Then in World War II, they called it battle fatigue. But in World War I, they gave it perhaps what is the best descriptor when they called it shell shock. Our combat veterans are given lots of drugs to try and cover up their symptoms. But many of those drugs come with some pretty nasty side effects, and one of those is suicidal ideation or suicidal thoughts. I'm sure you're aware that military suicide is now an epidemic in our country. For the past 7 years, HUGS has taken on the mission of making a difference for our men and women who come home changed by war. Wounds need oxygen to heal. Using a treatment called hyperbaric oxygen therapy, HUG-sponsored troops are given 80 hours of concentrated oxygen. In a dive chamber, using increased pressure or hyperbaric, oxygen concentrates into the plasma, which can then cross over the brain-blood barrier to promote healing of the brain. Robert couldn't even sit in the stands of a small-town soccer field to watch his daughter's games. Now he's once again coaching her team. Richard was in constant psychiatric care at the VA almost every single day, but after completing treatment, he runs a productive farm with his loving family by his side. G.K. Chesterton said something I really like. He said, "A soldier doesn't fight a war because he hates those in front of him. He fights because he loves what is behind him." For the past 17 years, the HUGS Project has been honored to help support America's armed forces. Your donations and our low overhead of 1.4% make this possible. Please know I'm not a medical person, but I am someone who 9 years ago suffered a concussion and a hematoma from a bad car accident. A year and a half later, I was having lots of issues of foggy thinking, couldn't give speeches, I had trouble remembering people's names, and all that was caused by the car accident from the brain injury. I was stepping out of the leadership role at the HUGS Project because at 62, I believed I was entering early dementia. But now I can tell you firsthand, HBOT really works. Oh, and that Navy veteran in an earlier slide, that's my husband Ray, who had a blood clot last year. Surgeons had to amputate his right foot. Infection set in while he was in the hospital during those 2 different stays while they surgically tried to clean out the wound and then heal it with very potent antibiotics without success. They feared he would have to become an above-the-knee amputee in order to stop the infection. He also began to have what he called a frightening sensation of random electrical charges in that leg. This is a Navy fire controlman. He called them voltage checks. But after about 10 to 12 hyperbaric oxygen sessions, both the infection and the neuropathy were gone and have never returned. I'm sure you now understand why both Ray and I are strong believers in this treatment. Hyperbaric oxygen therapy currently has 13 conditions which are covered by insurance. Those include severe burns, diabetic foot wounds, crush injuries, carbon monoxide poisoning, radiation injury, for example, as a result of cancer treatment, and many more. Studies indicate that it is very effective for treating strokes, migraines, and Lyme disease. In Louisiana, COVID-19 patients who were going to soon be put on ventilators improved dramatically using HPOT. Even Mayo Clinic states on their website that hyperbaric oxygen is recommended for things that aren't yet covered by insurance, including traumatic brain injury. So until it is, the HUGS Project is helping fill that gap for young combat veterans. We desperately need your help, and we sincerely thank you for your consideration.